Narrow bypass technique in the posterior mandible, when to do, where to do, how to do, what are the indications for a narrow bypass technique. So main thing is when there is an atrophy of the mandible. When does atrophy happens? When the patient uses the dentures, removable dentures for more than 2 decades or 2 sets of dentures, or if the patient is having any systemic condition wherein if the patient is undergoing radiation therapy or any other ailments for which the mandible has reduced, mean the size of the mandible has reduced, I mean that the crustal height of the bone has been reduced. So in such cases there will be atrophy. For such patients we need a narrow bypass technique. So the regular conventional implants, it's difficult to do the narrow bypass with the conventional implants because it's a 2-piece implants wherein the implant is separate and abutment head is separate. Or otherwise, if you are going to do narrow bypass with the conventional implant, means you have to place the implant and use the multi-unit angulated abutments, that is abutments of 30 degree, 45 degree, which will be connected to the implant later and go for the prosthetic impression procedure. So usually this technique of using a multi-unit abutments and narrow bypassing with the conventional implant will be difficult. It is almost impossible. Whereas in basal implantology, we have come up with single piece implants, cone shaped single piece implants, which are we call it as a king of corticals or BCS implants. We can place these implants in the atrophied mandible, and we can bypass also. We can bypass the mandibular canal or inferior alveolar nerve. Usually inferior alveolar nerve from the pterygomandibular raphe here, from the pterygomandibular raphe, it enters here. It passes through the third molar, second molar, first molar, then it exits through the mental foramen here. Okay, it will give few branches from this area, that is up front in the first premolar and canine area. There may be branches also. So usually in such cases also we have to be careful placing the implant in the first premolar and the canine area, because if there are branches from the mental foramen outside this canal, so usually this mandibular canal, the bundle runs towards the lingual aspect of the third molar, lingual aspect of the second molar, and again it comes towards the buccal vestibule and runs through the buccal aspect of the first molar, and it will come out through the mental foramen. Okay, so in the edentulous ridges where the patient doesn't have teeth, using dentures, all those things, usually the distance of the lingual cortical plate from the mandibular canal will be more than 6 mm. I will repeat again. In the edentulous cases, when there is a complete edentulous case in the mandible, usually the patient is using the dentures for many years. In such cases, the distance from the mandibular canal to the lingual cortical plate will be more than 6 mm. So it's easy to bypass lingually in such cases. I mean, it is easy to bypass the nerve from the buccal to lingual aspect in the edentulous cases. So usually it will be more than 6 mm, the distance between the mandibular canal and the lingual plate. The distance between the mandibular canal and the buccal vestibule will be usually the 4 to 5 mm. So that is the distance, and the distance from the superior border of the mandibular canal till the crest of the mandible is around 14 to 16 mm, depending upon the type of atrophy. So these are all the main important parameters: the distance of the mandibular canal from the bundle to the cortical plate, from the bundle to the buccal vestibule, and also from the superior border of the mandibular till the crest of the mandible. So all these distances are important. You have to evaluate through the CBCT while doing the bypass technique. Okay, while doing the narrow bypass, usually we do in the edentulous cases when the case is ready, when there is no extraction, all those things needed. So when the site is ready, we usually do the narrow bypass in atrophied mandible, where the distance from the mandibular canal till the lingual cortical plate will be more than 6 mm. We can easily bypass the implant. We can bypass the implants from buccal to lingual. So this is the way we do the bypass technique. So we can do, usually we do the lingual bypass in many cases. We can do the buccal bypass also from lingual to buccal direction. So Advantages of a single implants in bypass technique is that since the material of the implant, that is a titanium, is made of grade 5 implant, and the diameter of the KOC used here is a 3.6 or 4.1 or 4.2 mm, we can bend the implant abutment. Okay, we can bend the implant abutment to the proper occlusion, to the prosthetic arrangements, whatever the proper prosthetic adjustments, we can bend the head of the implant. So this is the main advantage of the single piece mono implant, wherein we can bend the implant up to 25 to 30 degrees. So since we have bypassed the implant from the buccal to lingual, there will be angulation. So after complete placement of the implant in the cortical bone, we can bend the abutment head to the proper occlusion before going for the impression procedure. So this is how we do narrow bypass. So the main thing here in narrow bypass is no need to worry about the nerve damage, all those things, if you can analyze the CBCT properly or the OPG properly. Usually for nerve bypassing you need a proper CBCT images as well as the proper measurement of the distance what I have explained, that is the distance of the mandibular towards the buccal cortical plate, distance of the mandibular from the lingual cortical plate, and the distance of the superior border of the mandibular canal with the crest of the mandible. All these things plays a major role while placing the implant by the method of narrow bypassing. So this is the way we do the narrow bypassing. The same way it holds good for both on the left and the right sides. So even though if there is a atrophied mandible, we can place the implant in the cortical plates and good primary stability and anchorage. Only thing is we have to do nerve bypass. So this is the proper way of bypassing the nerve. This kind of bypass technique is almost impossible to do in conventional technique. Okay, so I explained in detail about how to do narrow bypass. Thank you so much.